Welcome to the Orthopedic Center at Wesley Medical Center. We are very pleased that you have chosen us for your joint replacement surgery, and we are committed to providing quality care as well as making your recovery comfortable and successful. Joint replacement will improve your quality of life by decreasing pain, increasing mobility, and improving your ability to perform daily activities. Our goal is to provide you with a comprehensive overview of your upcoming experience. The knee is one of the most complicated joints in the body. It consists of a kneecap, patella, the upper bone, femur, the lower bone, tibia of the leg. These all are bound together with ligaments, tendons, and muscles. Cartilage provides a cushion between the bones and enables them to move smoothly. Total knee replacement is the replacement of a damaged knee with an artificial joint. A total knee replacement is comprised of three parts: a metal part covering the femur surface, femoral component, a plastic and metal part covering the tibia surface, tibial component, a plastic part that resurfaces a kneecap, patella button. Your physician and the surgical team will carefully customize the size of your knee replacement so it is individualized and customized to your lifestyle. When in place, the artificial components reconstruct the knee into a functional knee joint. After a successful operation and recovery period, the knee is progressively less painful and has improved motion. Each patient is unique. Please speak with your physician to find out more about your specific surgery. Wesley Medical Center offers a pre-admission and testing program for total joint replacement patients. Please schedule this appointment with the pre-admission clinic 7 to 14 days prior to your surgery. The nurses in the pre-admission clinic will complete a comprehensive evaluation, including current medications, previous surgeries, and your health history. The clinic will obtain blood work, EKG, and a chest X-ray. Your insurance company will be billed for any tests that are conducted. Further testing done at your primary care doctor's office will be reviewed with you during your appointment. A free preoperative education class is also offered. Make a list of your medications, prescription, over-the-counter, herbal, and any other. Bring this information to your pre-op appointment with your physician, as well as your pre-admission clinic appointment. Your physician will tell you which medications are safe and what you should discontinue prior to your surgery. Medications such as aspirin, fish oils, vitamins, ibuprofen, other nonsteroidal anti-inflammatory drugs, and warfarin, Coumadin sodium can increase the risk for bleeding. Inform your physician of these medications, as you may be instructed to stop taking these 7 to 10 days before your surgery. If you have not stopped taking these medications as your doctor has prescribed, your surgery may be canceled. Do not shave your legs for at least 5 days prior to your surgery. Nicks and cuts on your skin from shaving can contribute to infection. Here is a general list of items you should bring to the hospital. Please leave everything else at home. Photo ID and insurance card, co-payments or deductibles. If you have pre-registered, payments will have been arranged in advance. Comfortable, loose-fitting outfit for working with a physical therapist. Advance directives, living will, medical power of attorney documentation. Eyeglasses or contact lenses with case and solution. Hearing aids with case and extra batteries. Shoes, walking, sturdy and comfortable. Energy to get moving and return to your life. We will provide you with everything else, including toiletries, towels, washcloths, comb, deodorant, mouthwash, and toothbrush. Your safety is our priority. Our goal is to make you feel secure while you are in our hospital. Every member of our staff is dedicated to exceeding your expectations by providing you with a safe, healthy, and secure environment while performing their jobs carefully and competently, using safe and effective practices and technologies, including frequent hand washing, preventing falls. Please note this includes helping you to the restroom. Privacy comes second to safety. Using electronic medication record with barcoding technology. Responding to needs in a timely manner, including hourly rounding by the staff to check on every patient with the 5 Ps: pain, position, personal belongings, potty needs, and pumps. Ensuring timely and effective communication between caregivers and patients by answering questions about your treatment and your health, providing you with specific information about your care, and explaining changes with your treatment. Bedside shift report between off-going and oncoming nurse is conducted bedside for your benefit. We want to discuss your pain control plan at this time as well. A nurse leader will visit you every day during your stay and conduct what is known as patient rounding to answer your questions and address any possible concerns. Following your surgery, a nurse will check on you frequently. Your nurse will monitor your blood pressure, heart rate, respirations, and oxygen level, help you control your pain, monitor your IV, check your dressing, observe and empty your drain, ask you to move your feet, ask you to cough and breathe deeply, check the pulse on your foot to make sure the blood is flowing nicely, get you out of bed. Movement is very important for healing. Most patients will typically receive antibiotics for 24 hours after surgery. You will also be prescribed blood thinners while at the hospital and for your recovery at home. Blood thinners help prevent blood clots from forming. Pain is a natural response to surgery and should be expected. However, pain after surgery can be successfully managed by your patient care team. Your orthopedic nurse will work closely with you to provide compassionate care and appropriate pain control. Our goal at Wesley Medical Center is to work with you to develop a plan that effectively manages your pain and reduces potential side effects. Your nurses and doctors will collaborate with you to develop a personalized plan. All plans include the consistent administration of pain medication that will require us to wake you during the night to stay on schedule. This will ensure a comfortable level of medication remains in your system. Specific needs are identified during an initial evaluation on the day following your surgery. At this time, we will develop a treatment plan that addresses your specific needs. Participation in therapy sessions is crucial for recovery and will determine your ability to return home safely. Multiple studies have shown that patients who begin early activity recover faster than patients who do not. Eating a balanced diet after surgery is important for your recovery. Remember, you should plan to increase the amount of protein in your diet, including eggs, meat, cheese, milk, and beans, because these foods aid in the repair of your muscles and joints. We will even provide you with protein drinks to enhance your protein intake. Once you have achieved your milestones in the hospital, you are ready to go home. Your doctor, nurses, therapist, discharge planner, and social worker work together to advise you on where to go after your hospital stay. Typically, you will be discharged to your own home or the home of a friend or relative. Initially, we recommend that you arrange to have someone helping you regularly at home. The discharge planner, who is usually a case manager, will talk to you about your specific needs and the resources available to meet those needs. Some needs may be met by arranging for a visiting nurse, physical therapist, or occupational therapist to come to your home. We will do our best to make arrangements for you to be able to return home for the healing process. Once at home, remember these important points. Continue the exercises described by your physical occupational therapist. Continue to use your assistive equipment and follow the precautions taught by your therapist. Plan daily, routine rest periods. Do not take baths or submerge the incision in water without your doctor's permission. Do not return to driving a vehicle until your physician says you are cleared or ready. When you go home from the hospital, your incision and surgical areas may be slightly swollen and sore. Notify your doctor if any of the following occurs: increased pain or new areas of discomfort, increased redness and swelling, drainage from the incision, a temperature or fever above 101, chest pain or shortness of breath. It is important to tell any doctors and dentists about your total joint replacement. If your doctor has advised you to use antibiotics to protect your new joint, you should take oral antibiotics before and sometimes after any invasive procedure, including any dental procedure where the gums might bleed, including teeth cleaning, cystoscopy, examination of the bladder. It is also important to treat any bacterial infection with antibiotics. Bronchitis, sinus infections, and bladder infections are examples of problems that should be brought to the attention of your physician. We appreciate you taking the time to watch this comprehensive overview of your upcoming joint replacement surgery experience. Thank you for choosing the orthopedic department at Wesley Medical Center. For more information, visit wesleymc.com.